What's the process for securing NHS continuing healthcare funding?
It's a two-stage process consisting of two separate assessments, the first being a continuing healthcare funding checklist assessment. Now this is designed as a screening tool to ensure that only those individuals with issues that warrant a full multidisciplinary assessment are passed through to that assessment stage. It is, however, envisaged to be a wide net that's being cast and shouldn't be excluding individuals with health needs. Really, it's meant to ensure that only those who are fairly fit and well don't pass through to a full decision support tool assessment. So the checklist assessment can be conducted by any healthcare professional or indeed a social worker. So ordinarily it may well be that a nurse from a nursing home undertakes it, or the clinical commissioning group may employ a team of nurses within the continuing healthcare funding team who go around completing checklist assessments. Additionally and separately, it may be the case that an individual social worker completes a checklist assessment and it's then submitted to the clinical commissioning group. The process for which an assessment being conducted will vary from clinical commissioning group to clinical commissioning group, but they are the overall responsible body for undertaking these assessments. Now the checklist itself looks at 11 separate areas, and those are in order: behaviour, cognition, psychological and emotional needs, communication, mobility, nutrition, moving on to continence and skin, an individual's breathing, medication needs, and the final aspect is their altered state of consciousness, which covers aspects such as whether somebody has seizures or has suffered from strokes, TIAs, absent periods. Now the checklist will look at each of these domains as they're referred to and will score them as either being A, B or C. If an individual scores 1 A in the area of behaviour, breathing, drug therapies and medication, or altered state of consciousness, they automatically pass and trigger for a full assessment regardless of what other scorings they receive. Secondly and separately, if they score 2 or more A's overall, that will automatically trigger for a full assessment, or if they score 1 A and 4 B's, or finally 5 or more B's, they will also trigger for a full assessment. So it's varying different combinations as to what can constitute triggering. It's important to ensure that the individual and or their family representative or advocate is afforded an opportunity to partake in a continuing healthcare funding checklist, and the views of the family member where appropriate are included. If you are informed that an individual has had an assessment and you weren't party to it and you don't agree with the outcome, it's very important to make sure that you request it to be done again and be given an opportunity to partake. Having triggered an assessment at the checklist stage, an individual will then be assessed via what's known as the decision support tool assessment. This is a much fuller examination of the health needs of the individual and looks at the same 11 areas I just mentioned with the addition of a 12th domain which is simply referred to as any other needs. So in essence, anything that has not been covered within the initial 11 areas would be recorded there and given a level of need accordingly. Now, it's different. It differs to the checklist in that it's not a matter of A's, B's and C's under the DST, which is the abbreviation for a decision support tool, but rather it looks at scoring the individual's needs from no needs, low needs, moderate needs to high needs, and in certain domains higher levels still of severe and priority are potentially available. An individual's will be assessed by a multidisciplinary team, so it's crucial that it's not simply one individual that's undertaking the assessment. Normally the format would be an individual nurse and as a bare minimum requirement thereafter a representative from the local authority in the form of a social worker. This is crucial because it gives an opportunity to look at matters in terms of the individual's health issues, not just from a clinical perspective, as would be provided by a clinician such as a nurse, but also from a social care perspective. So the two matters are looked at from different starting points to decide overall whether the individual's needs surpass social needs and become primarily health needs. and that is the criteria for an entitlement to full continuing healthcare funding. Once an individual has been assessed by the multidisciplinary team across the 12 domains, the levels of need, as we talked about, will be recorded. It makes it clear from the DST that if there are 2 or more severe scorings in any of the domains, there is an expectation that an individual would be considered primarily to have health needs and an entitlement to the funding. It's also important to note, however, that there must be the requisite intensity, complexity and unpredictability in nature of their needs for there to be an overall consideration that primarily the individual's needs are health needs, and that is the criteria for an entitlement to the funding. It's not necessary, however, to have all 4 of those areas, but rather any combination of, or even just one, will result in there being a conclusion that there are primarily health needs. Once the MDT have completed the documentation and given their recommendation, that is then ratified by the clinical commissioning group, and the decision will be conveyed to the patient and or their family or representative. It's important to note that the National Framework for Continuing Healthcare Funding makes it very clear that the recommendation of a multidisciplinary team following a decision support tool assessment can only be overturned in exceptional circumstances. So it should not be the case that an individual receives a recommendation at the DST assessment and you are then informed in writing thereafter that in fact they're not eligible for funding. Only if clear, exceptional reasons for such a decision are provided would that be appropriate. An example would be that if the evidence provided to justify a particular level of need did not tally with the level of need having been given, that would be one example of what might constitute an exceptional circumstance. So I'm of course exaggerating matters, but say for example somebody was awarded a high for mobility on the basis that they have a high risk of falls as evidenced by a risk assessment and a falls history, and the evidence in support of that was that they had run a 5-kilometre race that weekend. Clearly the two do not tally, and it would therefore be appropriate for the CHC team to intervene, or the clinical commissioning group to intervene and overturn that recommendation. If, however, the evidence clearly supports the levels of need and the recommendation made by the multidisciplinary team, then the clinical commissioning group do not have the power to overturn that recommendation because those exceptional circumstances would not exist. Hopefully, therefore, where an individual's needs have been identified correctly and a recommendation for funding has been provided, that will result in the individual being given continuing healthcare funding. Following an initial award of funding, the process will again be reviewed 3 months later, and because having been awarded funding, it does not mean you're entitled to it for life, because clearly the individual's needs can worsen or improve over time. So there would be an initial 3-month review to check that it is still the case that the needs are primarily health needs. So long as they are, then there would be annual reviews every 12 months or so, confirming the same position. If, however, there was a marked improvement in the patient's condition and the CHC team were made aware of that, then of course they may seek to review prior to this 12-month annual review. If in the worst case scenario, a recommendation for funding is not given and the patient or their family firmly believe that their needs are health needs, then there are avenues available to appeal the decision independently. And there are separate appeal processes available where you can challenge that decision and it can be overturned either at local level within the clinical commissioning group or ultimately at NHS England level. If you have any queries regarding continuing healthcare funding, we are as a company specialists exclusively dealing in the matters of continuing healthcare and all issues that surround it. Compass CHC provide a free advice line where we'll be more than happy to discuss on a free, no obligation and strictly confidential basis any issues or queries you have regarding continuing healthcare funding. We'll be able to advise you as to particular issues you may have and how we can overcome them and the services that we can provide. Our telephone number is 0121 227 8940. Alternatively, you can contact us via an assessment form on our website at www.continuing-healthcare.co.uk. Thank you.